Now, we have lived for over a year with the pandemic, and you have been in constant contact with peers all over the world to chart a path to recovery. What lessons can we learn in ASEAN from previous epicenters like India?
Good morning, Sophie. I think, there are two main lessons. One, in terms of prevention, is there's totally no room for complacency until there is an extensive coverage of vaccination of the population. The true and tried measures of public health, reduce social gatherings, social distancing, masking, and all that has to remain in place until we have a substantial number of people vaccinated. And number two, in terms of hospital preparedness for surge, as we saw in India, and to a certain extent experiencing here in Kuala Lumpur, there's nothing like being prepared for this surge of infections in the hospitals and, having adequate beds and ICUs ready. So I would say those are the two.
On that, most ASEAN governments are aiming to stay the course on reopening plans in light of the economic impact. And as we learn more about the COVID mutations, what then should be the strategy to allow for this stronger preparedness, whether it's to provide more support in the hospital sector or other aspects of policy?
I think one thing that's important is having a good surveillance and testing strategy. The problem with SARS-CoV-2 virus and COVID-19 infection is that it's silent. As you know, 40% or more of people have very mild or no symptoms at all. And so having a good, fine test, trace, isolation, and support strategy is key, so that we don't have these runaway infections, and then all of a sudden we're faced with huge numbers of infection. I think that's where one of the problems lie in Malaysia, because we weren't looking for infections and isolating them and contact tracing them quickly enough to contain the infection.
And with that, Adeeba, we have seen a shift in community transmissions, primarily to factories and manufacturing sector. Is enough testing and tracing being done in these areas? Will more be done to boost those efforts in Malaysia?
Well, actually, Sophie, if I may correct you, I think although it would appear that a large proportion of the infections are in the factories, and that's true, I think perhaps up to a quarter of the infections are coming from the factories. But, an equally large proportion is already in the community. We have 60% or so of our infections are what we call unlinked, indicating that, it's out there in the community. So a testing strategy would have to be these fine test trace in the community. But you're right, a comprehensive program in the factories and construction sites that are a source of infection.
So, Adeeba, testing is one pillar. Vaccinations is another key area that will allow for a faster pace of reopening. In our interview with the Malaysian Finance Minister on Monday, he reiterated the need to stay agile to allow for this national recovery to take place. Daily cases topped 11,000 in the days following that interview. What's your assessment of the vaccination progress being made in Malaysia to achieve the goals set out under the NRP?
Yeah, so I think that's one area we're doing very well, and in comparison to many of our neighboring countries. So in the last few days, I believe our vaccination rate has been up about 400,000 per day, which is, very good, but of course could be even faster. And we have, I think, approximately a quarter of the population now having had one dose, and about 12% have had 2 doses. Nevertheless, I think we need to really pivot our vaccination. I believe this is going to happen soon, to states and areas with high incidence of infections, including Kuala Lumpur and Selangor. Kuala Lumpur has reasonably good coverage of vaccine, but Selangor and Negeri Sembilan, the other hard-hit states, will need to ramp up their vaccination.
Could Malaysia reach the government's goal of being in phase 2 for the whole country by early August? From your vantage point, what is the situation on the ground to achieve this?
I think if the supply of vaccines come in, we should be able to ramp up our vaccination, but it will require mobilization of, healthcare workers and other support staff to make sure that this happens ASAP. The projection is by October, we would reach our target population coverage. But until then, we're having to do all the other necessary things to combat the surge of infection.